being in front of the camera. So it was really hard for me to do the first video and almost as hard as to do this one. So here we go. We left off last week, had the CAT scan, and all the results came back on that. That's when we found a lump inside that nobody knew about, and that's when it got a little more serious for all of us. I mean, this is bad enough, but there's a mass that was roughly the same size, which they at that time was about like a egg, in the chest, and it's actually pushing my heart over, pushing on the heart, pushing on the lungs a little bit, and was still is decreasing blood flow. So that was another contributing factor to the shortness of breath, the lack of energy, just being tired all the time. Which in the first video we talked about mono, and I didn't really connect the dots for you. We will today. It's important, but I didn't know about it. I didn't know how important it was until just recently, so that's why I kind of left it open. We'll explain it here. So we find this new mass, and the doctor's, it's not that he's more worried, but he was a lot more, okay, we gotta, this is serious. So scheduled biopsy for right here, which is this scar here, and he said, the biggest thing we have to worry about is taking enough. And like I said in the last video, it's like, oh, there's plenty there. Take as much as you want, because it was especially then it was getting to the point where it was push on the throat at night and not really making it hard to breathe, but making like you could feel it when you're swallowing and stuff. And yeah, like my hair, that's hat hair right there. Another weird thing is this. My hair is turning colors for some reason. I don't know why, but it's turning blonde. It's really weird. Anyways, so also in the last video, you probably noticed I was itching a lot, coughing a lot. Itchiness is part of is a symptom of lymphoma. So had I known that, we probably would have got in sooner, because I've had severe itchiness for a long time. It's just like something your lymph nodes control and clean your skin. The lymph nodes are used to clean impurities that come in contact with your skin, and so when they get all crazy with cancer, they kind of go haywire, and you have night sweats, which those are horrible. Like 4 times a night you get up and you dry off and you wait for the pool in the bed of sweat. You wait for that to dissipate, and the itchiness, a little bit of fever, fun stuff. So anyways, we go in for the biopsy. And at that point, I'd had a little bit of blood taken, and I've had the IV for the CAT scan, and that was it. This is the first surgery since I was little, 4 and under, for cerebral palsy. So I wasn't nervous because I knew it would be okay, but I was anxious, I guess. So get to the hospital, get checked in, they make you get naked. Well, you wear a dress, the little gown, little cute little thing, and laying in the bed. They do the IV in the hand. That was Not fun. Uh, I'm a big wuss when it comes to needles, and the IVs it could almost, like at points it would almost not hurt, but it pretty much, like, there's a little bit of a sting the whole time for me. But like I said, I'm a wuss with that stuff. So, get the IV going, do a bunch of paperwork, and then they roll me back. They're going to put me under. They roll me back into the pre-op room. It's got little panels in the ceiling with flowers and fun stuff. And looking around, it's kind of cool, like cold. And the anesthesiologist comes up, and she's a nice lady, and she explains the drug she's going to give me. I'm going to feel really good, and then I'm going to be out. And okay, fine with me. I don't want to know about any of this stuff. So they roll me back into the OR operating room, and it was freezing cold in there. And I made two movie references last time. I'm going to make a show reference this time. The Agents of S.H.I.E.L.D., if you've seen it, in the third season, they really cover it. The Tahiti Project, it's a room with a robot hanging from the ceiling with a bunch of little needles and stuff, and they're manipulating the brains of people that have died in action, and they're bringing them back to life and changing their memories and stuff. Creepy, super, super creepy. And I go through the door, and there it is, this thing hanging from the ceiling. And it's like, this is looked just like it, except that it didn't have pokey needles sticking out of it. But boy, I was like, oh my gosh. And luckily they had already started giving me the medicine, because they said, well, we need to scoot over to this bed. I got scooted over, and that's the last thing I remember. I was out like a light, and then woke up back in the pre-op and back in the different bed, and orange from the nipples up. Their antibacterial stuff that they use. Yeah, they had painted me all the way around, so that means they had rolled my body around while I was unconscious. They had shoved a tube in my mouth while I was unconscious. They did all sorts of stuff to me. I didn't know anything about it. That was like the creepy part. I was like, holy crap, they were doing all sorts of stuff to me. I didn't know about it. Had no clue, no memory of it at all. But whatever. So they bring me back to the room, and I thought I was going to have to sit there for hours while they monitored me, but the nurse came back and said, okay, like 20 minutes later, okay, you ready to go? Oh, okay, cool. So, yeah, I mean, it was a little sore, but it went well. So, had the biopsy. Things went well. Met with the doctor a week later or so, and results came back. Yes, it is cancer. We finally have the official diagnosis, lymphoma. We don't have. It gets more specific, but lymphoma. Yes, that's what I have. Okay. So, we had the biopsy, and we got that result back. We then set up our first appointment at the cancer center here locally with the oncologist. That's how you say it. Had a meeting, and they drew blood there, which they didn't tell me about. That was not fun either. They did a lot of. They took three vials, ran a whole bunch of tests on just those little 3 vials. I was surprised how many different tests they were able to do. Did that. We talked about the results we had so far, or they had gotten back so far. um, and it is Hodgkin's, classical Hodgkin's lymphoma, type B, which I don't know I still don't know exactly what that means. It's a way to classify the symptoms that I have. I have B type symptoms, um, which is the night sweats, itchiness, a little bit of the fever. There's also excessive weight loss, which I don't have. Um, so then, um, and he called it bulky disease because of the size. It's stage 2 because it is above the abdomen and not below. And it's only on one side. It's this side. So we had our first meeting. They talk about the port that they're going to put in me. And that freaked me out. I don't like it. But, which you'll see a theme. Anytime they're going to do anything to my body, I don't really like it. But, all my whining, complaining about needles and junk, that's nothing compared to how this idea of the port thing grosses me out. Still to this day, I have it in me. Still grosses me out. So they we talk about the results, the type of lymphoma, highly curable. They talk about, at that point they were saying possibly 6 to 8 treatments, chemo treatments, and at that time they were unsure if they were going to do any radiation at all. They said if radiation is done, less chemo would be done. So we left that meeting. Me and my wife had drove separately. There was a fender bender when we left there with our truck, and so that just added to the day. That day, it was frustrating, but really funny afterwards. It's like, really, just get the cancer diagnosis, then get in a fender bender. Wonderful. Well, so next up is a schedule to have the port put in. Which, if you don't know what a port is, port a calf. It is a disc, little circle disc, plastic with this, I don't know what material is on the top, but they put it in, and it's right here. See here? So, yeah, you see that? That's where they went in. It is down just a little bit below that scar. It goes in right underneath the skin, has a rubber tube on it, and a needle that sticks into a main artery, vein, whatever they call it, inside of you, and that's how they inject the chemotherapy. Instead of doing a bunch of your veins everywhere, because by the time you would be done with your treatments, they could very well have blown out all of your veins from sticking you so many times. I had the option to not do the port, but they made it pretty compelling. They put cream on it so it would be numb. They claim I won't feel it. Don't know yet, but we'll see. But I think I'd rather do that than have different veins poked on me every single time I go. So, same thing. Go in. Have to get in your dress again. And same thing, they put you under. Talked to had same nurses, same anesthesiologist. Like, hey, like freaking flyer miles. So go back. That time, for whatever reason, I was awake much longer in the OR than the first time, and I was scared to look around, so I just kept my head straight, looking up, and eventually went out. And I mean, they were talking to me and stuff, and I was talking back, and then I was gone, and um, came to back in the pre-op, and my legs were shaking because I don't know. With the cerebral palsy, my nerves are sensitive anyways. They kind of do that sometimes, and I remember waking up to that, and boy, like the biopsy didn't really hurt. They subscribed some pain meds that I never used, but the port, I woke up and it hurt. It hurt quite a bit, and I was like, oh, I need something. So they gave me some good stuff, and took the pain away, and went back to the room, and I guess it had taken twice as long as planned, because they got in there, the mass was pushing the artery really, really bad that they were wanting to go into, so it took them twice as long as they had planned. So it's like, yeah, you're going to be sore for a long time, and it was. And they said I couldn't lift anything with that arm for 2 weeks. It was terrible. So, had the port, got all healed up, and then and then the fun stuff came. So, CAT scan, biopsy, port. Now we have the stuff that. This is the funny part and the horrible part at the same time. So they schedule me, and I don't remember all the dates, but I am to have a bone marrow test, a MUGA scan, which is for your heart, and a lung test, all in one day. So get there bright and early. Same thing, get in the dress. I was able to keep my t-shirt on, though. So, not sure if there's any constellation prize there or not. Get there when they want me to get there. Get in the dress. Laying there. Really long time. Felt like forever. And, like this is the longest wait I'd ever done. And they told me that the bone marrow thing, that I would be awake, but they were going to give me some drugs that I wouldn't care at all. That was a lie. So, waiting there forever. End up watching this show, this like PBS show, and they were the U.S. Army was in the Antarctic doing exploratory research, and that seems really boring. But I watched the whole thing. So they finally come in. Nurse comes in. We're going to give you, she says, small IV. I don't know what the difference between a regular IV and a small IV is, but she gave me an IV in the arm again, and so do that. Same thing. Oh, this hurts, whatever, and so she does that, does a whole bunch of paperwork, and then they go away for a while again and come back, and she's like, okay, we're going to get started. It's like, we're not going to go back in another room or something? No, we'll do it right here. Okay. And so I'm laying on my bed, and the nurse comes over to the left side, brings some stuff, a cart of stuff. I don't remember. And then my oncologist, Dr. Wahid, comes in on the right side. Hey, good morning. He's a nice person. He doesn't talk much though. He's like, we're gonna get started, and they gave me Demerol, which it was a really good drug in the fact that I felt very loopy, and they said I wouldn't care. I didn't when they weren't doing anything. Yeah, I didn't care about anything in the world. And so they get started. He's like, we need you to roll over towards the nurse and get into the fetal position. I was on drugs, so I was like, yeah, sure, whatever, I don't care. Roll over. Well, I'm trying not to expose myself to the whole world. Remember, I've got the dress, and it's open in the back. And so I get rolled over, and sitting there, got the pillow. I'm just, whatever. And I was like, oh, I think I need to go to the bathroom. And then I farted. I farted in his face. And it wasn't just a little one. It was pretty good. I was like, oh, never mind, I'm good now. So I farted in his face. That's probably why it hurt so bad. But so he said, I'm going to tell you every step of the way. I'm going to tell you what we're doing. I'm like, okay, whatever. He's like, you're going to feel a little sting. I'm going to do the local anesthesia. He says, feel like a little bee sting. That was a really big bee. Boom! Okay. Fine. He's like, okay, now I'm gonna put the larger needle in and find the spot. In a nutshell, bone marrow test was important because your blood's made in your bone marrow. We wanted to find out if there was cancer cells in there. That would have made it a higher stage, still curable, but more treatments would have been necessary or whatever. So to get to the bone marrow, the easiest way was basically on my hip butt area. So where there's just skin and then your hip bone's right there. Yeah. So he shoves the needle in there. Ooh, that hurt. Yeah, felt that one. And they pulled it out. And I'm thinking, yay, we're done. Awesome. Nope. He shoves it back in. Boom! Oh gosh. And then he's feeling around with like his fingers or something, like pushing, like he's trying to break the hip up, break the bones up. Here, we'll just mash them in. Yeah. No, that was not fun. And so he pulls it out again. And he's like, I'm having a hard time finding the right spot. Thinking, great. This is just that my whole story's been like this. And he's like, we're going to try it one more time. And if we don't get it, we just won't do it at all. Okay. Well, boom! Right in. Oh, got it. Great. Oh, it was hurting by then. 3 stabs in, he gets it. And he's in there for a little bit. And he pulls it out, and I'm thinking, awesome. Okay, we're done. I can go home now. Or go to my other test now. No. Apparently that was to numb the bone. The outer part of the bone. Apparently it has nerves. I didn't even know. But then he says, and all the time I'm over here on the side looking at nothing, but the nurse is right there. I'm just, I've got the pillow, fetal position, I've got the pillow and I'm laying on the pillow and just, she's got the guardrail up so I don't fall off the bed. And he's like, you're going to hear this sound. Ring, ring. It's a drill. Nobody told me about a drill. No, we're not using a drill. No. Yeah, he had a drill. And he's like, you won't feel a thing. I beg to differ. So he starts it, and it just, whew. It did not hurt that bad. But I work on cars and trucks and all sorts of metal and stuff. Drilled bazillion holes. Anybody that's used a drill, you know when you're drilling into something, mostly metal because wood won't really do it. You're drilling into metal and it catches a little bit and kind of torques it around. Yeah, or like you can feel the chunks kind of popping out of the hole. I could feel that inside me. I could feel the bone kind of chipping away a little bit, which it hurt a little bit. It didn't hurt a ton, but the nurse was like, "It's just the sound. It's just the sound," and I'm like, "No, no, no! I know what this is. I know this feeling. It's like, this is horrible." And so, didn't take very long. Then the drill was done. And I'm thinking, now we're done. Now I can roll back over and be done. No. He says, well, I'm sorry. And I'm thinking, what are you sorry for now? What now? And he's like, this part's going to hurt. And I'm thinking, and the rest of it hasn't? This is, So, and I never looked over to my right side. I did not want to see the instruments he was using. But he's like, the inside of the bone and the bone marrow cannot be numbed. So this part's going to hurt. He shoved a needle down in there, and I'm sure it was like this long, I'm sure it was, 30 foot long, like that big around. He shoved it in there. When he shoved it in, it hurt. But literally the worst pain of my life. When he started drawing that bone marrow out of there, it just, I had that pillow, that hospital bed pillow, full size. By the time he was done drawing that stuff out, I had turned it into a concrete ball under me of just, And finally, we were done. And I had been drilled in the butt that day. Oh, that was terrible. And that was the first test of the day. Now, they didn't have me do the heart test and lung test first and then get drilled in the butt at the end. No, we did that first. So, the nurse bandages me up and make sure everything's good. Then I get to lay there for a while. And then they throw me in a wheelchair and go up and do the heart test, the mugga scan. And it was pretty uneventful. Another IV. Well, they kept the IV in, so but they put some radioactive markers in my blood and took super close pictures with a camera here and like a camera here, and it was close quartered. It was really close. I'm not claustrophobic, so that was good because it was half an inch from my nose once they ran it up and down, and did that, and then nothing crazy happened there. The lung test, that was had to sit in a glass box with the door shut and breathe into this tube. Had to do just a bunch of breathing in a bunch of different ways. It, had in and out, and then you had to like puff, and had to go through it like 3 different times. I was wore out by the time that was all over with. So now we're at the point to where I've had CAT scan, the biopsy, the port, the bone marrow, mugga scan, lung test. I've had all that done. Had blood work done, um, and we're to the point now to where I was like, okay, now we can get started on treatments. Well, things have not gone as fast as I thought they should, but that's fine. Whatever, whatever the doctors need to do. Um, so at that point, I'm trying to think. We had a second meeting at the cancer. No, I'm sorry. Then I had my PET scan, which that was luckily uneventful, but it could have went terrible. Had another injection. This was crazy. So the PET scan is another giant camera, kind of like a CAT scan, kind of, but it's a long tube. It's not a donut. It's a long tube that you go in, and this one is on a semi truck in a big box trailer thing that travels. So that was interesting, getting to climb up into a tractor trailer and have them test down there. So walk in and sit down in a chair. It was small. It was close quarters. The wall was up. I was up against the wall, so we couldn't use this arm like I normally do, because there's apparently a good vein there that everybody likes to use. So the guy was going to use this other arm, but he's got a workstation, and basically what it is they inject radioactive sugar into your bloodstream and take a whole bunch of pictures, and anything that is metabolizing that sugar in any place in your body where it shouldn't be is cancer. So, he gave call the day before, made sure we were good to go. He said, you can't, don't want to be touching your kids the day of your injection and all this stuff. Crazy stuff. I was like, holy cow. I said, am I going to glow when this is over with? No, we won't glow. Dang it. Okay, fine. And so, get there, get up in the truck, get sat down, and he's got, I've seen in the movies the bank vaults with the wheel, to open, or like a submarine hatch. He's got like that in the table of his workstation. And so he unscrews it, pops it open, and grabs out this syringe, without a needle on it, just the plastic part. And it's got a steel casing like this big around it. I'm thinking, gosh, dang, this stuff is really radioactive if you've got to have it in a sealed container and in a casing that big around. That's crazy. Well, okay, let's do this. Not sure how injecting radioactive stuff in your body's good, but whatever. I'm not a doctor. So, he goes to do the a butterfly IV, I think he called it, in this arm. Well, he did it, and I didn't even feel it. I literally didn't feel it. I was like, wow, that's the best IV anybody's ever done. That's crazy. Well, I spoke too soon, because I guess he missed or went all the way through the vein or something. He tried to pump a little bit of saline in, and it just made a ball, and it hurt for like 2 days. A ball in there. It's like, well, dang, we're not going to be able to use this. Okay. So kind of lay over and do the other arm, and Same, boom, and it hurt slightly, but he did the best IV out of everybody that's done an IV on me. Some dude in a semi truck rode around in a semi truck doing PET scans. He's like, well, it helps when you have sharp needles. I'm like, well, yeah, that's kind of, you'd think that would be normal, but whatever. So he does it, puts saline in first, then does the thing, and then you got to sit there for 20 minutes. There's an older lady there that's getting a PET scan right before me. Chit-chat a little. And then it's my turn to go back there and go back. And you know how that CAT scan table was really narrow? This is like the same or worse. I was like, holy crap. They had one pillow for the head, and then he was going to have me keep my arms over my head, but I think because of the port and everything, we decided, he's like, well, you can just keep him by your side, and I'll strap you in. Okay. That doesn't sound so bad until you realize you're going to be strapped in with your arms by your side where you cannot get out for 20 minutes of pictures. 20 minutes! And then with being itchy all the time, I started praying. Seriously, started praying. I was like, Lord, please don't let my nose or face or anything get itchy. And there's a few times I got an itch, like right here, like right now. And I was like, okay, we can get through this. And he's like, okay, we're done. 20 minutes goes by, we're done. Awesome. He rips that thing off, and I'm just like, that was the worst part. It was a little close. I mean, it was proximity. Again, I'm not claustrophobic, so it was fine. But, woo! Yeah, 20 minutes without being able to scratch when you've got itchiness all over your body. That was crazy. So that's done. Finally, the last test that we're doing before the treatments start. Finally got it done. I go back to Dr. Corrado. He checks the port. You make sure everything's good. It's fine. Go to the cancer center for the second time to talk to the radiology doctor about their plan. And so go there, take the truck, and park in the parking lot, go in, get back into the room, start talking to the doctor, and over the speaker in the building said, well, the owner of a red Dodge pickup and parked in the cancer center parking lot, please. Something, I couldn't hear the rest. And I look at the nurse, I said, I am the owner of a red Dodge pickup. And she's like, okay, let me go, as long as you're fine, let me go see what's going on. Like, yeah, it's fine. Remember, the first time we went to the cancer center, that truck was in a fender bender. Only, it put a streak of white paint on the bumper, is what happened the first time. So, talked to the doctor for a few more minutes. She comes back in. She's like, I'm so sorry, but somebody's backed into your truck. It's like, I just started laughing. I was like, well, I hope they flipped it over or totaled it or something. I hope they destroyed it at this point. It's like, and we're trying to sell this truck and everything else. And she's like, they're still getting all their paperwork together. I said, do you want to wait here, talk to the doctor a little more, or do you want to go out? I was like, no, just when they're ready, just let me know. And we're so talking to the doctor that find out that we're going to do 4 to 6 treatments of chemo, and then like 18 rounds of radiation, which sounds like a lot, but it's consecutive days. So it's not like it takes a year. It's like every single day you go in for a radiation treatment, and it takes minutes. So we're looking at 5 to 7, maybe 8 months for the full go around. So, talking to him just about minor things, and then the people get their stuff around and go out, and they had backed into the truck in the same spot it had already been hit, so now it has a black mark, and like that's all the damage it had done to the truck. It had pushed their bumper off of the car, inverted part of their bumper, all this stuff. The lady was like really distraught. It's like, it's not a big deal. It'll be fine. When it was in the fender bender before, it had hit a Dodge Journey. It broke, smashed the fender, the bumper, broke the ball joints, the upper control arms. It destroyed that Journey, that Dodge Journey. Put a white mark on the truck. So maybe we shouldn't get rid of it. Maybe it's indestructible. I don't know. But so that meeting's done. Well, I go back in and we finish up the meeting. Another thing. Found out during this meeting that it's not officially linked, but there's an extremely large case of people that have that get mono end up with lymphoma. I guess the mono virus, it really alters your immune system. You eventually get better. As far as the symptoms go, it takes a long time, and it took me forever. But the virus never leaves. Just goes, I guess, dormant or whatever. And I found out also that my virus has become more active again for some reason. They don't know why. But there again, with the tiredness, just added it just more. Just so many things compounding on that one issue. So that's where the connection between mono and lymphoma, they say there's a very large percentage of people with that get mono end up with lymphoma. Not everybody, and it doesn't go, say it both ways. Just because you get mono doesn't mean you'll get lymphoma, and just because you have lymphoma doesn't mean that you had mono at one point. It's just there's a high correlation between the two. So that's where that connection was that I was telling you about. And so then we're waiting for my chemo class to learn about all the different effects of chemo, and wait a little bit, and then finally that comes up, and we just did that. It would have been a week and a few days ago. So go to that, and man, the drugs they're gonna give me, and I'm not gonna bore you with all that, but it's a I guess nationally regulated regimen of drugs that make up chemotherapy, and if anybody cares, it's the ABVD regimen. Whatever, it's the 4 to 5 different drugs that they give you. So we're in there, and she's going over like the side effects, which were ridiculous, because the first one would be like diarrhea, next one would be constipation, and then weight loss and weight gain, and this is for the same drug. I'm like, well, which is it? I said, well, just give me all the good ones, the weight loss and the I'd rather have constipation than diarrhea. Just saying. I saw at the bottom of that first page, it said hair loss. And I was like, well, that's just a possibility, right? That doesn't mean that it's a for sure thing. And she just looked at me. She's like, no, it's for sure. So it's going to happen. Dang it. So, go on to the next page. Like, all the symptoms are like the same almost. And like every single one of them, all 4 or 5 of them or whatever, hair loss, hair loss, hair loss, hair loss, hair loss. Well, guess that means I'm... So what you're saying is I'm not going to have any hair. Yeah. Cool. So, she said, but the dumb thing is that by the second treatment, your hair's gone. By the third treatment, it's coming back. Well, then why did you leave in the first place? Couldn't you just stay around? Whatever. So, yeah, that was the third trip to the cancer center, and we did not get a vehicle hit that time. We didn't take the truck. Took the car. Didn't get hit. So, yeah. Talked about, different appetite and stuff. My appetite will change. Just everything about me is going to change a little bit. So we're going down to Texas on the 28th of this month for a second opinion from MD Anderson Cancer Center. It's not that we think, not that we don't trust anything these guys have said. I mean, like I said, it's a nationally sanctioned. Like it's a, it's not just something they're making up on their own. It's an actual certified deal. So it's not that we don't trust them. It's just, second opinions are good. You get second opinions about buying tires for your car, might as well get a second opinion about cancer. So that's the next step. We're going down to Texas to get a second opinion. That place is the best world famous for lymphoma cancers. So I guess we'll go see what the best in the nation or the world has to say. Other than that, I mean, that's where we're at. It's been a fun ride so far. We did get to see the infusion room where I will be spending 5 to 6 hours getting chemo every 2 weeks. But it was sad going in there, seeing all the people. There was quite a few people in there at the time, and they were all very sad. And I understand. I'm just weird, I guess, because I was laughing with the nurse in there. We were laughing and cutting up, and everybody was looking at us like, "Would you shut up? We're trying to not die here." Oh man, it was making all the nurses laugh and stuff, and everybody's, well, he got such a good attitude about it. Well, what else are you supposed to do? I'm not going to sit here and cry about it all the time. I haven't cried yet, so we're good there. I guess I've just been dealt such interesting blows in my life as it is. When this came around, I was just like, oh, great, another thing more crap to deal with. So, we're going to deal with it. Like I said in the last video, I'm a Christian, and it's going to come up in these videos. My faith is definitely a huge reason why I'm good. I mean, I've got they talk about in the Bible, they talk about joy unspeakable, and having peace unspeakable. I've given it to the Lord. I know I'm not going to die. We just got to get through it. So that's like I said, my faith is a big deal here, so it's another big part of it. And so, I guess we're all caught up, guys. I will let you know. I will come out with another video when there's something interesting to talk about. So, there's that. We do start, as long as MD Anderson doesn't find anything groundbreaking, we'll come back and start treatments. It's like December 6th. It's Monday. It's the first Monday in December we start treatments. So, like I said, as long as MD Anderson doesn't find anything, we'll be starting chemo in December. So, until something crazy happens, see you guys later.